Hello everyone, greetings wherever you are watching from. Welcome back to this channel. Welcome back to this channel where we talk about your health, where we focus much on a preventive health. We give tips on how you can improve on your health, on how you can live a healthy lifestyle, on how you can reduce some of the risk that might make you develop some of the health conditions that are so many in the world today. In our today's episode, we are going to talk about autoimmune conditions or autoimmune diseases. As a doctor or as a health professional, one of the best treatments you can give to your patient is to be a shining example to them. Being a shining example just simply means you need to be healthy, you need to be fit, you need to have a healthy lifestyle, something that can also encourage your patients to be better. It is quite difficult to live a perfect life, but you can be smart enough to live a healthy life. No one can be 100% perfect in terms of living a perfect life or a healthy life, but at least you can be smart enough on how you do your things, because ideally we are exposed to so many things, some of which are so difficult to avoid or get away from. But at least we can try to minimize or reduce some of this risk. I was checking, for example, the tap water that we use. The tap water that runs maybe from the treatment plant or whichever place it comes from. What do you think that tap water, in that process of transportation, what it goes through? We realize that it contains heavy metals, it contains a lot of agrochemicals, it contains a lot of microorganisms, so many things that if you take it just that way without maybe filtering or putting it into treatment, you are going to introduce a lot of pathogens into our system, some of which and most of which are carcinogenic. So that's how dangerous and how risky our life is nowadays. But at least you can make a choice to live a healthy life. You can make a choice to educate yourself. You have the capacity to educate yourself, to gain some knowledge, to be informed on what you can do to improve on your health. Because for example, our health system currently is tuned in such a way that it is diagnostic centric. When you go to the hospital, their focus will be to determine what you are suffering from and give it a name. That will be their focus, to try and find out what you are suffering from, and maybe say they have diagnosed you with diabetes, and maybe say you have malaria, and maybe say you have hypertension. So they just try and diagnose what you are suffering from, give it a name, and try to manage it. Manage it with chemicals, these drugs, most of which are made up of chemicals. But remember, If 1 plus 1 is 2, one chemical plus another chemical cannot be two chemicals. If you try and figure out from your chemistry things that you learn in chemistry, you realize that one chemical plus another chemical, one good chemical plus another good chemical can come up with a very dangerous compound. Some compounds some of which have not even been identified. So that is how risky our life is. You introduce some of these two different chemicals that are safe in their individual nature, but you have no idea when they combine the kind of compound they will form and how the compound, whether it will be safe or dangerous to your system. And some of these unknown compound that these two different chemicals come together and form might be the cause of some of the unknown conditions, some of the causes of these chronic conditions that can't be cured due to unknown cause. So the current system just diagnose, give it a name, and maybe put you into management or give you drugs, most of which are just chemical. The current system mostly manage that symptom. They are focused in treating the symptom. Maybe if you are admitted in the wards, each and every day the doctor will come and try and ask you, how are you feeling today? I have good fever, I have some headache. Then they will manage that symptoms just continuously like that until maybe you feel a bit well. The current system just try to lifelong manage some of the condition that you are suffering from. Management of condition for the rest of your life, some of the condition that you are suffering from that has no cure. So the current system will just try and manage that. But when I ask yourself, how often do we empower our patients? How often do we explain to this patient the kind of diet and lifestyle they can live to try and reduce some of this exposure to some of this condition? What they can take in to reduce them from getting some of these conditions? How they can manage their nutrition to improve on their gut health, the health of their gut. Some of the physical exercise they can do to improve on their lifestyle. How often do we do that? Very rare. We'll just get there, they try and manage your symptoms, give a name to something that you are suffering from, and maybe give you some drugs to take. And continuously, these drugs are continuously being manufactured, some complex, a lot of chemicals to try and improve on disease management. But the questionable thing is that most of these drugs, chemical in nature, comes with a lot of side effects. Take for example patients who are under chemotherapy, for example, cancer patient under chemotherapy, the kind of life they undergo as a result of the chemicals that are introduced into their system. You find that this chemical, as much as they try to manage this cancer, they come with a lot of side effects. How then can we improve on that? There are a lot to be done in science to try and improve on our health, because when that currently things that we use right now introduces a lot of unknown things into your system, leading to cause of unknown diseases that can't be managed anymore. A lot need to be done. I'm not saying that we should avoid the treatment, but at least we can be smart enough to think of what to do. You can be smart enough individually to try and manage your life so well. So when I talk of autoimmune diseases, these are diseases that are developed when your immune system mistakenly attack its own self, the self antigens within your body. It attack itself mistakenly. So your immune system normally protects the body from infection. It is one of the first line of defense when you are exposed to a danger or infection. Your immune system will respond to try and attack the foreign antigen that gets into your body. It can be a bacteria, a virus, or any kind of injury. Your body will normally respond through an immune response. So your immune system, from the immunology perspective, normally you have two aspects of immune system. We have the adaptive and the innate immune system, whereby the adaptive is the first line of defense, the natural defense, ranging from your skin, the inflammatory markers, the monocytes, the neutrophils, those white blood cells, the granulocytes, basophils, the macrophages, those first line of defense that responds when your body is attacked is normally referred to as the innate immune system. Then we have got the adaptive immune system, where we could focus on the immunoglobulins, the B cell producing the immunoglobulins, the lymphocyte, the T lymphocytes and the B lymphocytes, the B cell and the T cell producing cytotoxic C cells, the killer T cells, things like that. That are the innate immune system. That is a little bit deeper, but how does autoimmunity arises and what triggers autoimmunity? So in your system and in your immune system, there is normally what we call the human leukocyte antigen. Human leukocyte antigen. These HLA genes are normally found or produced in the major histocompatibility complex. So these HLA genes are what acts as the identity card. They are what helps your system to distinguish between a foreign antigen and a self antigen. It gives your system the first-hand information that this is a foreign antigen, it needs to attack it, or this is self-antigen, it needs to restrain from attack it. So when your HLA system works properly, then the chances of you developing autoimmunity is reduced, and your body's defense systems will work efficiently. But when the HLA system misfires or misfunctions, that's when you develop an autoimmunity. Your body starts to attack its own self. For example, in rheumatoid arthritis, your body starts to attack your joints, causing some of inflammatory response in your joints, and all that leading to swellings and pain, the chronic inflammations, or what we'll call the pains and swelling the joints of your fingers, your ankles, your knees, things like that. And that will arise when the HLA system misfires or fails to function properly. So there are normally some triggers of autoimmunity, some of the things that maybe normally happens that leads to you developing an autoimmune disease. And one of the things that might trigger an autoimmunity, we have what we call the molecular mimicry. Molecular mimicry. In molecular mimicry, this is whereby, for example, a virus attacks you, and this virus tends to mutate or form itself in such a way that it appears the same as some of your cells. Maybe it has the same structure and the same appearance, some of your cells, like the cells of the pancreas, the beta cells of the pancreas. It mimics, just like a chameleon normally undergoes mimicry for survival. Some of these viruses and bacteria normally also undergo this mimicry for survival. So when the body detects these antigens and try to attack them, it will attack the invader together with the self-antigens that appears the same as the foreign antigen, because it recognizes them as the same thing, so it mistakenly attacks them. For example, when it attacks the beta cells of the pancreas that normally try to appear as mimic some of these viruses, you develop what we call the type 1 diabetes, because these beta cells can no longer produce insulin. So that is what we call molecular mimicry. Your self-immune system mistakenly recognize your body cells as invaders and attacks them, leading to some chronic inflammations that causes some of these autoimmune conditions like the type 1 diabetes. Attacks your joints, causing things like rheumatoid arthritis. Attacks your different organs like the skin, your liver, your heart, leading to you developing lupus as a result of molecular mimicry. Another trigger of this autoimmunity, we have got the leaky gut, whereby the lining of your intestine becomes weak or becomes damaged, so it is not able to distinguish, or it is not able to absorb only what it needs, and ending up even getting into the bloodstream some of these harmful antigens like the bacteria and viruses, getting them into your bloodstream. Something called intestinal hyperpermeability. Now everything just passed in a process across your leaky gut into your system, into your bloodstream, and being supplied to the rest of your body tissues and cell, causing different attacks, attacking your cells and tissues, leading to you developing autoimmune diseases. Then, what are some of the causes of this leaky gut? Leaky gut just as a result of poor diet, you taking excess sugar, processed food, taking too much alcohol, taking food low in fiber, you having a lot of stress, prolonged stress or chronic stress, you having a lot of gut infection, some of the medications that you take, food sensitivity. For example, we have a protein called gluten. Gluten is a protein that's majorly found in wheat. It's normally found in wheat. And it makes you develop some of these gut infections. So we have molecular mimicry, we have leaky gut, we have hygiene hypothesis, we have infection, food allergies, nutrition deficiency, not taking a proper diet. All these are some of the triggers of autoimmune diseases. Examples of autoimmune diseases, we have things like rheumatoid arthritis, your joints being attacked. We have got lupus, whereby your immune system attacks different organs of the body and tissues. We have got things like multiple sclerosis, where your nervous system is attacked and your spinal cord. We have conditions such as type 1 diabetes, whereby the beta cells of the pancreas are attacked and you are not able to produce insulin. We have thyroid autoimmune diseases. We have inflammatory bowel diseases. We have rheumatic heart disease and so many other things that interferes with your system, makes you develop autoimmune condition. So normally there is no that defined cause of these autoimmune diseases, but at least from this you are able to know some of the triggers of these autoimmune diseases, some of the things that can make you susceptible to them. So these are the things that you can manage to reduce yourself from exposure. So autoimmune diseases normally comes with some signs and symptoms, that most of which are the same to other normal conditions, but you find that you try to manage this other condition, you don't get any response, then there are high chances that you are developing an autoimmune condition. Symptoms like joint pain and swelling, as in the case of rheumatoid arthritis, things like skin rashes, things like muscle weakness, brain fog, low-grade fever, hair loss, unexplained weight changes, persistent fatigue. So not all these symptoms appear in each and every condition. Some of the symptoms are specific to various conditions. So causes and risk factors, we have talked about triggers. Causes and risk factors ranges from genetics, where family history involved. We have gender, and you find that women are the most affected with these autoimmune diseases. We have hormones, environmental triggers, we have lifestyle, things like that. Diagnostic is normally a combination of trying to check on the symptoms and doing blood tests such as the inflammatory markers, the C-reactive protein, the erythrocyte sedimentation rate is ESR. Try to check the anti-nuclear factor. We have the anti-CCP for the case of rheumatoid arthritis also. So we combine this with imaging such as X-ray, MRI, and CT scan physical examination, symptoms, and all that to try and define whether or not you are developing rheumatoid or any other autoimmune diseases. So diagnosis normally involves a combination of all these factors. And management just ranges from lifestyle management, as we always say. All these things start with just your lifestyle management that will help you to prevent you from being at risk of developing these autoimmune diseases. Trying to know your family history, do regular exercise, do an inflammatory diet. You try to avoid this inflammatory stuff. Reduce stress, that you expose yourself to, have adequate sleep. All this will help you in managing this autoimmune condition and preventing them from developing completely. So early detection is very important. Treating infection early so that they don't undergo things like molecular mimicry. We manage symptoms properly. Get enough stress, manage stress. All of these things will help you in preventing or managing these autoimmune conditions. So that is generally some of the basic things that you need to know about autoimmune diseases. Autoimmune diseases are so many, ranging from, there are more than 80 autoimmune diseases that have been identified in the world today. So they're ranging from 80 to 100 there. Some of the autoimmune conditions that have been identified. So you need to take care of yourself properly to ensure that you are not at risk of developing this autoimmune condition. Thank you for listening. If you love what you have learned, kindly share, hit the subscription button, and keep following for more. Thank you.